Hi, Dr. Present.
Hi.
Thank you for taking the time to talk to me today. I'm here representing the Slavic Community Center of Northwest, and as part of the work that we are doing, we've received many questions from community members about vaccines, about health, trust in the medical system. And our goal with this conversation is to provide people with clear, valuable information that's reliable by trusted experts like yourself. So thank you for being here to help us do that. And before we dive into the questions, would you mind sharing a little bit about yourself?
Sure. Well, thank you for having me. I think this is really important work, and I think there are a lot of really good questions out there, and I'm happy to maybe try to address some of them. So my name is Dr. Sarah Present. I am the Public Health Officer for Clackamas County, which is pretty much like the medical director for the health department, for the public health department. I'm also a family medicine provider, and I provide primary care in our FQHC over here at the Beaver Creek Health Center. So that's a separate job. I've got two jobs. I'm both a family doc and a public health officer. I've been in this job for about 10 years. I went to OHSU for my residency training in both family medicine and general public health preventive medicine. After that, I worked for 3 years at the Seymour Community Health Center over in Vancouver, Washington, where I was doing full spectrum primary care, including pregnancy care and delivering babies. So I don't deliver babies anymore, but I still do kind of the rest of primary care.
Oh, that's amazing.
Yeah.
Thank you for sharing that. It sounds like you have a very full plate. And it's great to hear about your background and the work that you're doing now. Very impressive. So now let's dive into the questions that we've been hearing from the community.
Sure.
Let's start with this one. How can people trust vaccines and the medical system if they have doubts about doctors and healthcare?
Yeah, so that's a really big question and a really important one. I think that having doubts is human and natural and part of being curious. And asking big questions like this is really the basis of science and of medicine. I actually went into medicine partly because I didn't like our healthcare system, and I felt like I could potentially make some changes within the system to help meet people's needs better. I also questioned vaccines a lot when I was pregnant with my child. At that time, I'd already had years of medical training, so I was trained in how to read the original research and how to really understand it and understand the science behind it. And in doing that, I determined that going with the CDC recommended vaccine schedule was absolutely the right decision for myself and my family. But not everybody has a medical training like I do. So I really encourage people to consider where you're getting your medical advice. Who are your trusted advisors around your healthcare? Figure out where they are getting their information and what that information is based on. Is it based on science or is it based on other things? And understanding where people are coming from when they're giving you advice is really the first place to start. I absolutely know that our medical system is flawed. There are medical providers that, both allopathic and natural, that take advantage of people for their personal gain. But that is unethical, and it is not the norm. Medical providers are in medicine because we care about people. Medical providers do not get paid for recommending vaccines. Vaccines are really not a profitable system for medical providers. We do it because we want to prevent illness in our patients. There are, however, some stories of people who have made financial gain by actually making up ideas or spreading ideas about vaccines that are not true. So, for example, the individual who did a study and published it of only 12 children that made the initial sort of link or suggestion that the MMR vaccine might cause autism was actually ultimately being paid to find that link, and it didn't exist. So that study was determined to be fraudulent, and it was retracted from the medical literature. But still, we really need to focus on who are you getting your advice from, and where are they getting their information from? Who do you really trust? And I really encourage people to talk to their doctors about your concerns around vaccine. And if you don't trust your medical provider, it's okay to find another one. There's a provider out there for everybody. But I would encourage you to really talk about it. And if your medical provider has actually reviewed the scientific literature, they are most likely going to recommend that you get vaccines.
Thank you. That was a very thoughtful answer, and thank you for being transparent with all of that information. Our next question is, how are vaccines regulated and tested to ensure they are safe?
Yeah. So in the United States, all vaccines go through an incredibly rigorous process before they ever get on the market or distributed to people. First off, researchers have to prove or demonstrate safety in the laboratory. At that point, they ask for approval from the Food and Drug Administration, or FDA, to move into clinical trials with humans. There are 3 stages of clinical trials, and they involve thousands of participants. At that point, there are 2 committees of medical experts, one with the Food and Drug Administration and one with the Centers for Disease Control and Prevention, or the CDC. The FDA officials review all of the scientific research and the clinical trials and determine if it can be approved and licensed as a vaccine. And then the CDC committee will review all of those same trials and determine who should be recommended to get that vaccine and at what point in their life. Both of these committees are very transparent. Their meetings are open to the public and they are online. You can watch them. You can listen to all the data yourself and how they're talking about it and questioning it and coming up with the answers and the recommendations. The director of the CDC will then take those recommendations, and once they approve them, then it becomes general public health practice. Even after that, so at that point, they can be distributed to the American population. But after that, the safety and efficacy is still monitored really closely by both FDA and CDC. So if a medical provider gives you a vaccine and you have an adverse reaction to it, we are required to report that. And so the CDC and FDA watches those reports really closely. If anything comes up as a potential concern, they'll review it and potentially change the guidance around the vaccine, or if it's a serious safety concern, they will take that vaccine out of the market. That's incredibly rare because of all the rigorous safety evaluations that have to be done before it ever gets there. Most of the time, if a vaccine comes off the market, it's because there's a newer, better product that may be more effective or may have fewer side effects. I think it's important to mention that there additionally are many safeguards in place for the storage of vaccines to ensure that they remain effective. Through the transport and while it's stored at the doctor's office, vaccines have to be kept in a very specific range of temperatures. So those temperatures are checked, and the storage unit is checked every single day to make sure that the vaccine remains effective. If there's any movement outside that range of temperature and the vaccine may not be effective, it's discarded immediately. Additionally, if it becomes expired, it's discarded and not used in people. And also, so there are many, many levels of safety monitoring. So the Oregon Health Authority routinely inspects the facilities, the clinics, and the records of the vaccine providers that they work with to ensure that everybody's meeting these really strict requirements around vaccine storage and administration.
Thank you. And I actually do remember a time where I came in for vaccine and they did check and had to throw away one that was past due date. So I remember that very clearly.
There are times that we get paged in the middle of the night that a storage unit may be off temperature and somebody has to run over and make sure that it's working. So we make sure that we keep them really safe.
Yeah, that level of detail, like about the review process as well and creating them is like really helpful to know. Now let's get into the science a little bit.
Sure.
How do vaccines actually work in the body?
Yeah, so to think about how vaccines work in your body, we have to talk a little bit about the immune system. So the immune system is a series of cells and tissues and organs that work together to defend the body from harmful bacteria or viruses, which I'm going to clump into the word germs. When a germ gets into the body, it starts to replicate and will attack the body in various ways depending on that germ. And that is called an infection. The damage to your body, the damage that germ does is the disease that germ causes. So your immune system comes in to fight it and protect you from the disease by fighting off those invading germs. That totally makes sense. We'll keep going. So your immune system is always on patrol in your body. If it sees something that shouldn't be there, it calls in all sorts of resources to fight it. Some of those first resources are systemic things like having a fever. So that's actually part of your body fighting away that germ. There are also certain blood cells that will start building proteins that we call antibodies that are specific to that germ. And that can take a couple of days. Once those antibodies are built, they basically attach to that germ, they inactivate it, and then other cells come in and they dispose of the inactivated infectious threat. So once those antibodies are built in your immune system, if that germ ever comes back again, they can be part of the response much more quickly. So it may take a few days for them to build in the first time, but if you ever see that germ again, they're there and ready to fight. So you can ward off the infection and potentially not get sick at all. So that protection is called immunity, that memory. And sometimes for some diseases, that immune memory can be lifelong. So a vaccine works kind of like the theory of homeopathy, where you take a very small amount of an inactivated germ or just part of the germ, enough to get your body to have an immune reaction and build those antibodies. So that if that germ ever does get into your body can fight it without you getting potentially even sick from it at all. I think that's all I needed to say about that. So ultimately, vaccines often provide that long-lasting immunity without you ever getting, without any of the serious risks of the disease.
So yeah, that's a really great explanation. Thank you.
Yeah.
Next is something that many parents especially worry about, and it's side effects. So what are some of the most common side effects of vaccines, and how serious can they really be?
Right. So each vaccine has a vaccine information statement, which is a piece of paper that your vaccine provider needs to give you every time they give a vaccine. That statement is going to talk about that specific vaccine and any side effects that are unique to that vaccine. So just like every germ causes a different sort of disease, each vaccine responds in a little bit different way and can have some different side effects. An example of this, the varicella vaccine, which fights against chickenpox, sometimes has a side effect of a mild rash. But you wouldn't expect that from something like a tetanus vaccine. So some of them are specific. Some of the side effects are common across all vaccines. So that would be, if it's an injectable vaccine, which most of them are, you can have soreness, redness, maybe some swelling at the site that it was injected. Additionally, because your body is building an immune response, you may have some of those initial immune symptoms like the fever and fatigue. That really is just your immune system working. It can be very bothersome for some people, but it's not dangerous. It's not actually a disease, and it's not actually going to cause problems. There have been some very serious but very rare side effects. There have been some very serious but very rare side effects of vaccines that include things like seizures. It's even more rare for those serious side effects to cause any long-term problems for the person. Again, any serious response like that needs to be reported by the medical provider, the vaccine provider, to the FDA and the CDC, and they'll monitor to see if it's actually a threat to many people. The main goal is to ensure that the side effects of the vaccines are far, far, far less dangerous than any of the risks of getting those diseases themselves.
Right.
like I said, each vaccine is unique. You should talk to your medical provider and review that vaccine information statement about the particular risks of that vaccine and what you should do if you're feeling any of them. And just know that choosing a vaccine is usually, it's far less risky than the choice to be at risk of getting that disease.
So what you're saying is the benefits of getting the vaccine and building that immune system to fight those diseases and infections greatly outweighs anything those diseases will cause to your body.
Yeah. The diseases are far more risky than the vaccines to prevent against the diseases, 100%.
Thank you. It's reassuring to know that there are systems in place to monitor and respond to rare reactions, and that if we do have that, we have a way of reporting it and having it documented.
And I think it's important to remember that you may not feel well after a vaccine, but that's not because it's causing problems. It's because your immune system is working and making those antibodies and protecting you.
That's great. Some people also wonder about accountability.
Mm-hmm.
Are doctors held accountable if someone does have a serious reaction to a vaccine?
So because the doctor giving you a vaccine didn't make that product, then they are not typically the ones who would be responsible for that adverse event. The provider giving the vaccine does have the responsibility to ensure that you don't have any medical contraindications to that particular vaccine, or if there are any cautions that your unique situation may have against a particular vaccine, that it is discussed. If they don't do that, or if there are any errors in the administration of the vaccine, again, we report it to the vaccine adverse event reporting system. Additionally, we would report that to our management of our own organizations. If a doctor does make a mistake, there are internal policies of how to address that mistake and hold the doctor accountable if necessary. You're always welcome to ask your provider about their internal policies around incident response and vaccine reporting.
All right. Thank you.
Yeah.
Our next one is kind of a two-part question. What should someone do if they have allergies or other conditions that make them worried about getting vaccinated? And if a person had an allergic reaction to vaccine in the past or severe side effects, should they still get vaccinated?
Great question. So definitely talk with your vaccine provider. Each person is unique. Each vaccine has its unique ingredients and risks. I will say that general environmental allergies, like to the pollen outside right now, are not a risk for getting vaccines. People may be allergic to certain ingredients in a vaccine, and so each one should have an FDA-required package insert that lists the ingredients in that vaccine, and your provider should be able to review that with you. There are likely other vaccines that are still safe for you that have different ingredients. So really talk with your provider about your unique situation, and know that it is okay to question, and it is okay to ask your provider because they should be able to give you that information.
That's really helpful to know. I know a lot of people in their community were curious about that, making sure, it's safe for them to get these vaccines administered.
And sometimes, when we have busy clinic days, people don't feel like they have the time with their provider to stop and ask those questions, but it's that provider's job and responsibility to make sure that your questions are answered. So I encourage people to just ask.
Thank you. Yeah, it's really helpful to have that one-on-one conversation with your provider. So now this next question comes up a lot.
Mm-hmm.
If vaccinated people can still get sick, does that mean that vaccines are ineffective?
Right. Great question. So each vaccine, like I've said, is formulated for a very specific germ. And each germ is different in how it makes you sick in your body. So each vaccine is going to have a little bit different way of fighting that germ and potentially a different level of effectiveness. So, for example, one of the most effective vaccines we have is the MMR vaccine, which protects against measles, mumps, and rubella. The measles component after the two-shot series is 97% effective at providing full immunity. That means that 97% of people who get that vaccine will be fully protected against it from life. 3% of people have immune systems that may not respond, and they may still get the disease. But 97% is still really effective. There's really nothing in medicine that's 100% effective, so 97% is really close. Something like that, that works so well, we actually could completely eliminate measles if we try hard enough. And for me, if I'm going to get lifelong protection against something, I would much rather get the safe, effective vaccine than get the potentially dangerous disease. So whereas some vaccines like that effectively block the germ, other vaccines only prevent the most severe form of a disease. So that would be something we could expect from like the seasonal flu vaccine or the COVID vaccine. So the flu shot is adjusted every year depending on the flu strain that's circulating in the population. Mm-hmm. Because the flu virus changes from year to year as it goes through and around people, people can get the flu multiple times in your life. So the vaccine also cannot fully protect you against the virus because the virus strains are changing frequently. What the vaccines do in situations like that is they prevent you from getting severely ill if you do get the flu, and it can prevent hospitalizations. So these are two really different approaches to the vaccine. These are two really different approaches to vaccination. The efficacy of each vaccine is on that vaccine information statement, as well as CDC information and the FDA package inserts. So again, talk to your provider about what effective means and how effective each one is for that disease.
Wow. It's a lot.
It
is, but it's so important to know this. Sometimes it can be hard to know what information to trust. How can someone find reliable information about vaccines instead of misinformation or conspiracy theories?
Yeah, there's a lot of misinformation out there, absolutely. So it's always good to talk to your healthcare provider. And like I said, if you don't feel like you trust your healthcare provider, it's okay to talk to other people too, or other providers. They should be able to explain the scientific research to you around that vaccine most effectively. You can always reach out to your local health department. They're going to have good, reliable information about vaccines. There are also a couple of online resources that we highly recommend. One is the Vaccine Education Center at the Children's Hospital of Philadelphia. They have a very well researched and detailed sort of FAQs, or specific answers to frequently asked questions that parents have. There's also an app called Vaccines on the Go, What You Should Know, which is a catchy title, but they have got a lot of really good information, and I would recommend some sources like that.
That's really helpful, and thank you for providing those great resources. I'm definitely going to check them out myself. Yeah. The COVID vaccine in particular raised a lot of questions when it first came out, just because it seemed like it came out the next day after COVID was announced. So how were COVID-19 vaccines developed so quickly, and were they tested properly?
Right. So it was really incredible that the COVID-19 vaccines were available within a year of the COVID pandemic starting. It's a great feat of science, and I'm really thankful that there was all of this effort put into making a safe and effective vaccine that started to address the risks of this pandemic across the world. The fact is, though, that they were not, that the COVID vaccines have actually been researched and in development for a much longer period of time, as far back as 2003. So coronaviruses are a large family of viruses. And in 2003, we started seeing a very dangerous coronavirus called SARS. And so researchers have been working towards coronavirus vaccines since that time. So there was a lot of the research that was already there and ready when COVID-19 started. Because it was an emergency and a global pandemic, they really made a top priority. And many of the different groups came together to share research and work together. Additionally, they were top priority for approval. So researchers didn't have to wait and apply for funding and give more of that initial research and wait in line for other vaccines or other pharmaceuticals that were looking for approval and funding. It was really prioritized by governments and pharmaceutical companies. So really, the money was there for them to go to the front of the line as far as approval. And the clinical trials didn't take as long either. So we talked about how there are 3 stages of clinical trials that involve thousands of people. Oftentimes for a new virus or a new vaccine, you have to identify people who are still at risk of getting that infection. Because COVID-19 was new to everybody, there were a lot of people who are at risk of getting that infection. And then once they put out the word for volunteers, there were tens of thousands of people who volunteered to be part of that clinical trial. So that recruitment time was much shorter because people were ready to be part of the vaccine trial. Next, for full FDA approval of vaccines, they typically require a 6-month period of time to evaluate the effectiveness of the vaccine. We don't typically have delayed health responses to vaccines. If you're going to have a reaction, it's right away after getting the vaccine. So the safety evaluation in the clinical trials is really early on. And the longer time frame for clinical trials is really to assess the effectiveness. How well does that vaccine do against protecting against the disease or against the severity of the disease? Because people were dying and it was really an emergency, the FDA gave us an emergency use authorization so that we could start using it after only 2 months of that monitoring for efficacy. So people could start using it, and that, it was continually monitored. So at this point, the COVID-19 vaccine is probably one of the best studied vaccines that we have out there because so many people got it in such a short period of time, and we've been able to watch that effectiveness and that safety over time. But really, it did go through all of the normal steps of a vaccine approval. But in the state of emergency and the money that was there and the resources that were put into it, we were able to get it much more quickly.
Wow. It's interesting to hear how, if anything were to happen, it's usually, within the first 15, 20, 30 minutes, as what we were hearing is the long-term effects. Everyone was so worried about the long-term effects of COVID, having it be kind of quote-unquote new vaccine. And there was a lot of, misinformation around it because it was a new type of vaccine as well. It does not affect your DNA. Even though it's considered what we call an RNA virus, it does not affect an individual's DNA. And therefore, the long-term effects really are not the same as some of the ideas that are out there. Yeah. It's helpful to understand the context and, how the process was accelerated. But yet it was still very thorough, so absolutely gives that peace of mind for sure. For our final question, which kind of hits close to home in the Slavic community, many in the Slavic community are skeptical of vaccines. How do you suggest they approach this issue with an open mind?
Yeah. So I'm a mother. I'm a mother. I know that making the right decisions for our children is really tough and really complicated, especially when we have a lot of information from different sources. When my child was young, I worked really hard to prevent illness in ways like nursing as long as I possibly could, avoiding sugar, limiting screen time, these things that we know that are effective. And vaccines is just another one of those healthy choices that are proven and effective to prevent illness and make our children healthier and give them the best chance in life. But these decisions can be overwhelming. And when there is a lot of misinformation or questioning about it, it's hard to find the right resources. So like I said at the beginning, questioning is healthy. Just make sure that you find the right source for the right information that's based on science. To keep an open mind, we really want to look at all the points of view and all the science behind it, and who's recommending it and why they're recommending it. As a family doctor, I recommend vaccines to my patients because I care deeply about them and I want to prevent illness. I also care enough to, talk about each one and answer their questions. So keep an open mind by questioning is what I would recommend.
Yeah, it's really important to keep in mind. And for our very final question, where is the best place or places to get vaccinated?
So there are many places that you can get vaccines. If your healthcare provider, their healthcare provider is the best place if they have vaccines. If they don't have them available, there are many pharmacies that will provide vaccines for a range of ages. And in addition, the Clackamas County Public Health Department supports vaccine administration at our Clackamas County Health Centers. So you can always call them and you can get a vaccine-specific appointment with one of our public health nurses.
That's great. Dr. President, thank you again for your time, for answering all these questions so thoughtfully, with such clarity. These conversations really matter, and I know it means a lot to our community members to hear them directly from someone who understands both the science and the human side of these concerns. It's an important step in building trust, and I hope that we can continue to have these conversations more in the future. So on behalf of Slavic Community Center of Northwest and our community members, thank you so much.
Thank you for having me.